the Alpha study, there were 22 patients who were enrolled and treated, and 22 patients were evaluable for safety, and 19 patients were evaluable for efficacy at the time of the data cutoff for ASCO. So safety-wise, we observed that this therapy, both ALLO-501 and ALLO-647 conditioning, was very safe. We have not observed any dose-limiting toxicity here to date. We have also not seen any evidence of graft-versus-host disease in any of the patients. And we have not seen any neurological toxicity, also known as ICANS. About a third of the patients developed cytokine release syndrome, but most of those were grade 1 and grade 2 cytokine release syndrome. One patient developed grade 3 CRS, but that resolved fairly quickly. About half the patients had infusion reactions with the ALLO-647 antibody infusion, which is not unexpected, but they were easily treatable with supportive care, and no patients had interruptions of treatment. And we also found about half the patients have infections, but these were primarily asymptomatic viral reactivations with CMV that were picked up on weekly PCR monitoring and were easily treatable. In terms of efficacy, there were 19 patients who were evaluable for efficacy in this dose escalation study. The best overall response rate was 63%, and the complete response rate was 37%. The dose escalation has been completed in the low-dose ALLO-647 conditioning cohort and is ongoing in the high-dose ALLO-647 conditioning. So far, we have observed that there is a hint that with the higher ALLO-647 conditioning, we are seeing better CAR T-cell expansion and persistence, and that seems to translate to a deeper remission with 50% complete response rate with the higher ALLO-647 conditioning versus 27% with the lower ALLO-647 conditioning. The follow-up is still short, only about 4 months now, but 75% of the responses are currently ongoing, which I think is very reassuring, and so far indicates that the safety and the efficacy of this treatment with the allogeneic CAR T-cell therapy appears to be somewhat comparable to what's been observed with autologous CAR T-cell therapy that are in clinic today.